mixed dentition. What else?
Increased overjet.
Too big of an overjet, right? And quite a deep bite. So how would I describe this case? What's the molar relationship?
Class 3. Class 2, I mean.
Okay, molar, so it's a class 2 molar, right?
Next.
What kind of a bite is it?
Deep.
Severe deep bite. Moderate to severe deep bite. Moderate to severe overjet. Mixed dentition, class 2, with crowding. Is this a case that you would take? I'm sorry I'm blocking you, I just have nowhere to stand. So this isn't a case you would take because mixed dentition and a huge overjet, right? You starting to see the pattern here? What about this one? Let's describe the bite. You describe the bite to me.
So it looks like class 1.
Okay. Everybody agree?
No.
Class 3 on the right.
Class 3 on the right. Okay, yes.
This takes me back to school.
Mild class 3 on the right. Class 1 left.
Okay, so yeah.
What kind of a bite is it though?
End to end, slightly.
You could call it end to end, or but really orthodontically you would call it a anterior open bite.
Okay.
Anytime you look at your patient's mouths and you see dark space in the front of their teeth, that's an anterior open bite. Now it's a matter of like how much of an anterior open bite. Is it a mild anterior open bite, just a little bit, or is it a huge, severe anterior open bite? And the same thing goes with the deep bite. So if you see someone where you can't see their lower incisors at all, that would be like a severe deep bite, right? Okay, so go ahead. So you got class 3 molar right, class 1 molar left. What type of a bite?
So you have an open anterior bite.
Anterior open bite. And what about crowding?
So I would say moderate.
Moderate crowding, good call.
Cross bite.
Anterior cross bite. So any red flags here, you guys? Are the arches similar?
One's omega and one's like triangle.
But when you look at them, are they kind of similar? Like you have to kind of look at them. It's almost like looking at socks that you pull out of the drawer and it's kind of dark in your room. You're like going, is this blue or black or navy blue or black? They're kind of close enough where you can get away with it. So I have a blue, black, and a black now. They're close enough you can get away with it, right? So any red flags in this case, you guys? No, because like arches, a little good call. Whoever said that. Who said the anterior crossbite? Is that you?
I think you did.
Yes, sir.
Well, it was kind of a combination of both. He added the anterior.
That was a good call, though. And permanent teeth. So that's a case you would take, right? And there it is. What about this one? What about this case? What's the red flag, Doc?
Overjet.
Exactly. So what would you call? How would you describe this case orthodontically if you were talking to a line?
Looks like class 1 molar for the most part.
Okay.
A lot of overjet, right? Deep anterior overbite too. Oh, what's that one?
So he got all the description of it. When you describe a case orthodontically, you start with what type of bite it is. It's either deep bite, it's either anterior open bite, it's either cross bite. You have to kind of give the bite, like what kind of bite it is. So the first thing I would do is say deep bite case, severe overjet, and I'd probably say moderate to severe deep bite. So I'd say moderate to severe deep bite with a severe overjet. Class 1, if you want to call it class 1, with narrow arches and mild crowding. You see the description, the way you do it? Address the bite first, the arch shape, the type of crowding, and then if there's overjet, you include that in the bite description.
Is that a red flag?
What?
Would you treat a case like that?
No, what's the red flag?
It's the unlike arches
Overjet.
and then the overjet?
Yeah, mostly the red arch, the red flag is like that guy could eat an apple through a picket fence. Seriously. Seriously, that's a huge overjet. So the red flag is huge overjet. No.
Because the arches are pretty similar.
The arches are pretty similar. Yeah, I agree. So really the overjet is the key thing. They're saying the arches aren't alike, but I think you're right. I think they're in the ballpark. But the overjet's the killer there, so you just would nix that.
What if the patient just wanted straight teeth and didn't want to go through extraction surgery, all that stuff?
Yeah.
You weren't doing any AP, you just...
The way you have to look at it is, can I help this patient rather than making it iatrogenic. Like, if they want something and you can give it to them without everything else up, then you can do it. But if you're going to do what they want and it's going to make things worse, then no. Right? Because you probably have cases where like people just, I just worry about my social 6. I don't care about that my, you know, bicuspids and crossbite. And I don't have abfraction, I don't have perio. So yeah, she would say, okay, I'll treat that. And you'll see with Invisalign Go, that will be the case, because sometimes you'll see this afternoon, we're going to put in a case assessment and it's going to say like, go for it, doc. This is an easy case, 20 weeks, you're going to be successful. But we can't fix the, you know, the molar crossbite. So as long as you tell the patient we're not going to be addressing this, it's not their chief concern, then you would accept the case like the question you just asked. Yeah.
On these red flags, are you saying that Invisalign can't do it, or just that GP should do it with Invisalign?
It's beginning GPs should not take these on.
So would
Now she's taken cases on like this, I'm sure.
So
But
are you
I'm-
taking these on? Now?
Oh yeah.
Yeah.
I'll take on the train wreck.
Yeah.
I just think the crazier it is, the more fun it is. Because once you start doing, you know, as many as I've done, it's like you get bored with the simple ones. Like you salivate over them, but they don't get you excited. You know what I'm talking about? Of course. I like challenges.
Are you doing any sort of referral for LaForce or anything like that? Or are you
For what?
LaForce, or are you just doing camouflage?
No, we have surgical case referral. I work with 2 other orthodontists, so you know, if it's surgical stuff, we work them through that pathway. Okay, what about this case? Are the arches the same or similar?
Yeah.
They are. I mean, they're similarly jacked up, right? And you always notice, like, don't you always notice that, like, if one corner is messed up on the maxillary arch, the opposing corner is going to do the same thing, right? They always, like, go in pairs because it's the only way they can fit. Like, if this is all caved in, how's the lower going to fit unless it caves in with it? So in this case, you can see that that left corner is pretty jacked up. Now, let's describe this case. So who wants to take a shot at how you would describe it orthodontically? Go ahead.
Anterior deep bite.
Right? Moderate, severe, mild?
I'd say moderate deep bite or severe deep bite.
Moderate
Probably
to severe. Yeah, moderate to severe.
Deep bite. Normal overjet. Class 1 molar.
Why is the overjet normal?
Wink, wink, wink.
Because the 8, 9 are
Retrocline, yeah. Like class 2 division 2, right? You guys know what a class 2 division 2 bite is?
Yeah, and the
That's
molars
always
are-
when like the molars in the back are in class 2 relationship, but the front 2 teeth are retroclined and then the laterals are flared out. That's what's called class 2 division 2. So this patient almost is kind of, in a sense, kind of pseudo class 2 division 2. And if you look at the molar relationship, though, it's class 1, so it's not a class 2 div 2 case.
I'd say severe crowding.
Yeah, I'd say moderate to severe crowding.
Well, you would call that upper severe? Oh yeah, all
11.
freaking canines out there. Like severe, is that severe? What did you say, severe?
That's severe.
Yeah, severe,
Yeah.
yeah. Okay.
I don't think I'd call
It'd be
that
like
moderate.
if you're on the highway and you got pulled over and you were going 88. That would be severe speeding. This is like severe crowding. It's like severe crowding, right? It's not like crazy crowding. Like you're not going 120, but you're going about 85, 88 here. So similar arches. What's the hardest tooth that would be if you had to move that? She knows the answer. What would be the hardest tooth, Dr. Pope, that would to move in that mouth?
11.
Yeah, number 11.
22.
Hardest teeth to move are severely rotated canines and little dinky lateral incisors that you just cannot to come down because they don't have a lot of surface area. The aligner can't grab it, even with attachment. It has a hard time.
Looks like 22
Don't you hate those
is,
pesky laterals?
22 is kind of blocked way out there too, on that lower arch picture.
Yeah, but once again, this whole treatment would be, you know, pushing these teeth out, right?
Expanded.
Pushing these teeth out, and then that's going to make room for the 4 anteriors to
The bone will just
procline.
come forward
So
with
this
it.
is actually pretty easy. The difficult move, like Dr. Poe was saying, is number 11, because he knows that that's not going to.
None of that's really easy though.
No,
Not with a freaking aligner.
it's
That's
not
just-
really. This is not a case like that you're going to take on like right now. This would not pass Invisalign Go. And I didn't put this in. They gave me this thing. So, but once again, because the arches are similarly jacked up, and because it is an expansion case, and because the canines is really the challenge, if you were an advanced GP, you know, you would take this case on, right? Would you take this case on? See, she would take it on. And they say to take it on, but not as a beginning GP. But look at how nice it finished.
Now, is that, you didn't have to do much to the
This
canine,
isn't my
because
case.
the whole arch kind of expanded out and it kind of caught up to the canine.
Yeah,
It wasn't
exactly.
so much that the rest of the arch was right and then you had to really move the canine.
And you'll see that a lot in that you think like, when you look at some cases, once you start doing this a lot, you know, you can visualize, like I can look in my mind and I can see what the arch form is going to do when it's visually expanded. I know what it's going to do. And a lot of times just in getting things opened up, it resolves all the crazy moves that are around it. Yeah.
So this is gonna sound ignorant probably.
No, no such thing.
When it comes to.
It's an ortho class, there's no
Yeah,
other
so you're
question.
saying not to take that because of the management of the case. It's like my management is essentially monitoring the trays.
It's yeah, it's just it's kind of these are not simple moves and it's going to take a long time, and if you've never done an Invisalign case, it's not something you're just jump in and do right out of the chute. Invisalign go. That's where we're going. What about this case? Describe this case. You describe this case.
The open.
Wait, you guys, listen up. So she's describing this case orthodontically. See if you know the answer too.
Severe open bite.
Severe open bite, yes. Molar relationship.
Class 3.
Class 3, right, yes.